Okay, now we will discuss about Mendelian disorders. Mendelian disorders are the disorders which will obey the Mendelian laws, means first law, second law. Okay, those laws. Okay, now Mendelian laws, the disorders which obey the Mendelian laws are called Mendelian disorders. See, we have to learn two type of disorders: autosomal disorders and X-linked recessive disorders. Autosomal disorders and X-linked recessive disorders. Okay, now how to remember X-linked recessive disorder? There are only two type of X-linked recessive disorders in our in our human population. There, in our NCRT, there color blindness and hemophilia. How to remember? Chicky. Remember as a chicky, a sweet we will eat in our childhood days. Chicky. C means color blindness. H means hemophilia. See here color blindness. Color blindness means the person with color blindness will not able to differentiate green and red. What will happen if he does not able to differentiate green and red? He can't drive the vehicles. He can't drive the vehicle. See here 8% of males are more affected to the color blind, but females are 0.4%, because for male have to become a colorblind you have to have a single gene is enough for colorblind XY, but for female you have to become a colorblind there both the genes should be have the gene for the colorblind. Okay, so hemophilia is also similar case of as that of colorblindness, but in hemophilia we have to just remember one easy single word, that is hemophilia is a blood clotting disorder due to a lacking of a protein, cascade protein. We learned that clotting mechanism in a body fluids and circulation. Okay, now here many of the hemophilic patients can be seen in a acute Victoria family. Okay, next sickle cell anemia. Then remaining are all are autosomal disorders like sickle cell anemia, phenylketonuria, thalassemia. Okay, so here see sickle cell anemia is a qualitative. It is not a quantitative. It is a qualitative. It's a qualitative autosomal disorder due to a gene of HPS. It is a autosomal. Means when both gene for a sickle cell anemia are present, then only it is expressed. Okay, then only it is expressed. Here see phenylketonuria. Here, why sickle cell anemia is arising? Due to why this shape disorder is arising? Because of changing of a base pair of sixth position of beta chain. It is important. They will in examination they will give alpha chain. It is beta glutamic acid to valine. Glutamic acid to valine. What are the nitrogen is GAG to GTG. GAG to GTG. Here phenylketonuria. Phenylketonuria is a accumulation of phenyl. See PT square. We learn the aromatic compound tricks PT square. Phenylalanine to tyrosine. Here the enzyme required for conversion of phenylalanine to tyrosine is lacked. So here the phenylalanine is accumulated in the brain. It results in a phenylketonuria. Here symptoms are MRP. MRP means mental retardation, reduction in hair pigmentation. Okay. Thalassemia. We have two types of thalassemia: alpha thalassemia, beta thalassemia. Gene located on 16th chromosome, 11th. 4 square